Good day, ladies and gentlemen. I am Professor Kanu Ikechukwu Anthony, O.S.A, the Rector of Villanova Polytechnic, Imesi, Osun State, from the Department of Philosophy and Religious Studies, Tansian University. I am a consultant to the Civil Society Organization Network on Migration and Development. It is always exciting to speak on GFORM platform, and I thank you for the opportunity to speak to you in this capacity. The title of my presentation is COVID-19 and the Health of Migrants. COVID-19 pandemic has brought difficult situations for citizens of nations across the world. The effects, however, may be more severe for others, like vulnerable migrants, who are in desperate situations and whose conditions may well further deteriorate if not put into consideration. The possibility of the deterioration of the situation of migrants is based on the fact that, first, the precautionary measure of social distancing will place them in conditions where they will get less support and access to the basic necessities of life. This is evident with the developments in Italy and Libya. Secondly, they are not in a position to keep to the precautionary measures for preventing COVID-19, as they don't have access to clean water and soap to wash their hands, among others. Third, this is compounded by the fact that it has become more difficult than ever for migrants to cross borders and move into countries of their destination. This is obviously exposing them to health hazards. Fourth, it is even more difficult to return back to their countries of origin as borders have been closed by transit countries and also back at home. The implications are that migrants will have to stay in camps and temporary settlements where there are increased health risks and heightened psychological pressure of having hopes crushed after years of waiting and uncertainty. Fifth, some migrants have been deported during this period of COVID-19 and left in a situation of confusion and hopelessness. The search for an alternative place gives them no room of choosing where to go or stay, and thus places them at risk of associating with people who may have COVID-19. Unfortunately, migrants are unlikely to take priority in a moment in which governments are mobilizing all resources to care for their citizens. These concerns make the discussion on COVID-19 and the health of migrants a fundamental one. However, there is a need to further establish in general terms the connection between migration and health. Major documents on migration published by the Federal Republic of Nigeria, like the National Migration Policy of 2015, the Labour Migration Policy of 2010, the Draft National Policy on Diaspora Matters, and documents published by the international stakeholders on migration issues, like the International Organization for Migration, IOM, and the United Nations, make a very strong connection between migration and health. There are different phases in the lives of migrants that may leave the migrant with very serious health challenges to deal with, depending on the nature of the phase. The first phase in the life of every migrant is the pre-migration phase, which includes the reason for their departure. If it is a war situation or other forms of violence, the mental health of the migrant is already at stake. The second phase is the movement phase. During the process of movement, the abuses and violence that they encounter on the way can be very impactful on the health of the migrant. And because of the poor health conditions that many migrants encounter on the way, they are likely to arrive their countries of destination in a bad health condition. The third is the arrival phase. When migrants arrive at their destination countries, the way they are received has huge health consequences. Even if they are well received by their countries of destination, the conditions of those they have left at home continue to be a great worry to them, especially if their relations are still struggling to survive in a situation of war or other forms of violence. If they are separated with loved ones, especially a wife or husband, this has its own difficulties. If the migrant owes the person who smuggled him or her into the destination country or facilitated his movement, he or she faces the burden of working hard to pay the person. And so, different phases in the life of the migrant has different health challenges that it could pose. This makes a connection between migration and health in a general term. However, we shall now speak of COVID-19 and internal or domestic migration. There is a very strong connection between internal migration and COVID-19. COVID-19 as a push factor has affected the movements of people at the levels of internal and international migration. Internal migration concerns the movement of human beings within a geographical entity, usually a nation state, thus without crossing any international borders. Internally, Nigeria has seen the movement of people, especially the elderly, from cities to rural areas. The movement from cities to villages is because of the fact that COVID-19 is prevalent in cities than you have in the villages. The Kano State government, in a bid to curb the spread of the pandemic, on 21st April 2020 evacuated more than 1,000 Almajiris to their respective states and local governments. 433 Almajiris have been handed over to the Katsina state government at the Kano-Katsina border. Yobe was handed over 63 by the Kano government. Kaduna was handed over 198 Almajiris by the Kano government. Bauchi was handed over 101, Zamfara 1, Gombe 1, 9, Nasarawa 10, Niger Republic 1, Kano local governments 117, and Jigawa State 663. And so, COVID-19 has led to the movement of people, the migration of people domestically, internally, within the nation state of Nigeria. This establishes the connection between COVID-19 and internal migration. Now we'll talk about COVID-19 and international migration. International migration occurs when people move across international borders into another country other than their own to stay in the host country for residence or some minimum length of time. At the level of international migration, since the emergence of COVID-19, many Nigerians abroad have been returning home, and many are still asking to be brought back by the federal government. On 28 April 2020, the Minister of Foreign Affairs, Geoffrey Onyema, announced that the Presidential Task Force on COVID-19 will be bringing back Nigerian nationals from the United States of America, United Kingdom, United Arab Emirates, China, among other countries, in batches of 200. As Nigerian nationals are returning home, other nationals in Nigeria have been evacuated by their respective countries. On 19th of April 2020, about 300 American nationals and 293 British nationals were evacuated from Nigeria through the Murtala Muhammed International Airport, Lagos. These evacuations came after about 274 Israeli citizens were evacuated from Nigeria to their home country in March 2020. And these evacuations have continued in the days ahead of 19th April 2020. This establishes the connection between COVID-19 and international migration. It is also necessary to make a connection between COVID-19 and the Sustainable Development Goals and the health and well-being of migrants. The Global Development Policy was recast following the adoption of the Sustainable Development Goals at the United Nations General Assembly in September 2015. And the Sustainable Development Goals acknowledges migration as a significant driver of development and facilitating safe and orderly migration through well-managed migration policies. There are 17 goals in the Sustainable Development Goals. Number 1 is no to poverty. Number 2, zero hunger. Number 3, good health and well-being, quality education, gender equality, clean water and sanitation, affordable and clean energy, decent work and economic growth, industry, innovation and infrastructure, reduced inequalities, sustainable cities and communities, responsible consumption and production, climate action, life below water, life on land, peace, justice, and strong institutions, partnerships for the goals. Every goal in the Sustainable Development Goals has something to do with the well-being of migrants. But very important is the third, which says good health and well-being. The document also emphasizes the importance of safe and orderly migration. You cannot talk about safe and orderly migration while excluding the health of the migrant. And so the health of the migrant becomes a very important element in the achievement of the Sustainable Development Goals. There can't be development without achieving the good health of migrants, because development is holistic. And so if the migrants are excluded during this period of COVID-19, it then means that there is a crisis in the achievement of the Sustainable Development Goals. Having made these connections, what is the way forward? In view of the above discussions on the consequences of COVID-19 on migration, I propose the following as a way forward during this period of COVID-19 pandemic. The present situation calls for an inclusive approach by public health efforts in relation to the health of migrants, in such a way that it is all-inclusive. While governments need to tighten their borders and implement other measures in response to COVID-19, they also need to consider the impact of these on migrants and ensure that such actions do not prevent people from accessing safety, healthcare services, and information. Second, there is the need to reconsider the unjustified fear or suspicion of migrants as carriers of disease. This stigmatization has several consequences on the receiving countries, as migrants are more likely to be slow at seeking treatment or disclosing symptoms out of fear. Third, national public health systems should always consider migrants in their various schemes. They should be such that the migrants can afford. This is important as the world continues to work towards the Sustainable Development Goals. There cannot be sustainable development when the health of migrants is not put into consideration. The fourth, there should be an orientation for migrants, right from the time they are received at the borders of nations, on the precautionary measures to take during this period of COVID-19. These measures should also be written on or presented to them in languages that the migrants can understand and through appropriate communication tools. I strongly believe that if these are done, the situation, the health condition of migrants will be severely improved, will be greatly improved, and nations will be safer as well. Thank you, and God bless you.